Okay, so the question is, what's therapy? And I'm Dr. Bliss Lewis. I'm a psychiatrist and a psychotherapist and also an integrative medicine doctor. And let's talk about therapy. So there are so many different approaches to therapy and so many different types of therapists that, yes, it can be really confusing and vague and overwhelming. And also you may get different definitions from different people, depending on like the particular focus and angle. Right? But overall, therapy is a process of working with someone, right, with a skilled, trained individual to figure something out about who you are and how you work in the world, right? How your mind works, how your emotions work, how your patterns work, with the goal of giving you more freedom, right? So it's kind of important to keep in mind, like, why, what, right? It's to get free, right? To set yourself free from patterns or thoughts or whatever rigid issues are keeping you stuck, right? So really the goal is to give you the insight to understand what's happening so that you can have the freedom to do something different, right? Rather than to just auto-repeat the same thing over and over and over again. And then there are many, many different styles of therapy, right? Some of which may address something very particular, right? Interpersonal therapy focuses on like issues in the interpersonal work. Couples therapy, right? That's like you and a partner. Family therapy, group therapy, right? All these different things. And there are many different styles of one-on-one individual therapy, right? There are older, very established, more conventional approaches to therapy, psychodynamic psychotherapy, psychoanalysis, that was mainstream, that was the thing for decades. And then the next wave was these like very structured, shorter, CBT, cognitive behavioral therapy type therapies. Usually it's like some acronym, CBT, DBT, ACT, something like that, IPT, right? So we have plenty of those, right? That's the second wave. Those are usually time limited. It's a set of skills, right? It's figuring out how maybe thoughts, emotions, behaviors relate, helping you see your pattern of thoughts, emotions, behaviors, untangling all of it, learning some skills, right? So that you can live your life and be free from whatever anxiety, depression, whatever pattern is getting in the way, right? The next wave of therapies are a little different, right? Those are based on mindfulness, more meta, more looking at the mind, right? That's the newer wave, right? And now we have all kinds of additional fun therapies coming up too, with psychedelics and various creative therapies. So in this approach, really it's about just studying the mind and reflecting in a bigger way. And a lot of the mindfulness-based therapies are evidence-based. They do great, right? Really, in research studies, when you compare different styles of therapies, they all look pretty similar. They all do fine, right? It's maybe more about the match between the individual and the clinician, right? So maybe it doesn't matter so much what kind of therapy, but like, is this the right match for you, right? Is this the right person, the right therapist? And also, is there good, alliance, right? A bond of trust and safety. And does the technique, fit? Is a good enough technique? But all of these different therapies potentially can help with the ultimate goal of more freedom, right? And to get to more freedom, you also need to get to more flexibility, right? So all these different therapies are about becoming more flexible in your mind, right? Being better able to adapt, right? Because the one thing we know for sure is things keep changing. We want them to stay the same. We work so hard, and then they change, right? And then we are forced to adapt and adjust. And the better we are at this constant process of accepting change and adapting and being flexible and just being confident that we can like take on anything that life throws at us, right? The more ease, more calm, more serenity, right? More quiet mind, right? More confidence, more trust, right? More openness and availability because there's less fear, right? So that's what therapy is all about. How to know if you need to see a therapist. When is it the right time to see a therapist? And that is such a personal question. You know, I live in New York City, and in New York City, it's like everybody has a therapist if they can afford it or if they can find one, right? It's a cultural thing. It's like common and popular and kind of cool here, right? But there might be areas where that is not the fact, right? It's that there's no culture, right? Or it's harder to access. There's so much more access right now to therapy with like all the telehealth and in-network and free sources for therapy. So it's easier to access now, but it's still not totally easy, right? And it can take work. So, you know, sometimes people can access therapy because they want personal growth, right? And support and a sounding board to like bounce ideas so that they can be better in their life, in their relationships, like support for their growth on their life journey. That's a privilege, right? To access therapy like that. Versus sometimes there's a mental health need, right? Like if you're struggling with depression, anxiety, whatever mental health issue, to the point that it's getting in the way of daily life, right? So if there's an impairment in function, right? So that's the formal term of like, if some mental health thing is so serious that it is getting in the way of some aspect of your life, right? It's getting in the way of work, it's getting in the way of relationships, it's getting in the way of parenting, it's getting in the way of taking care of your health, then that's the time to go to therapy, right? Because it's just leaving it and allowing this mental health issue to like mess with your life. Well, that would be not great, right? And the longer you kind of leave it, the more it can like affect whatever area of life or maybe all areas of life, right? So the moment you see, this mental health issue is really affecting whatever, my relationships, whatever area of life, find a therapist. How to find and pick a therapist, right? There are so many, right? So many different styles, so many different therapists. How to know which one might be the right one for you? And this is a tough question because it's a bit like dating, right? Or finding friends. It's like, yes, you're looking maybe for a certain technique, but probably more important than the like technique or whatever, the 3-letter acronym or orientation is the person, right? You're looking for a relationship. So in the same way, you wouldn't just match with someone who has the right list of criteria for romantic dating, right? You have to like feel it out and see if it's a good match, if you vibe. That same thing applies to therapy, right? Some therapists might be amazing, but they're just like not quite the right match for you. Like something is just like, you know, your personalities, your styles don't just totally match, right? So look for a therapist with whom you're a good fit, where it feels like, oh, okay, I can really trust this person, I can really unwind in here, right? Because the goal is for you to develop secure attachment, right? It's an opportunity for a safe, secure relationship. So you want to find someone with whom you can feel safe and secure and with whom you can work in a way that's sustainable, right? So if the therapist has really high fees and that will limit how long or how often you can meet them, that might be an issue to consider, right? ideally you would find someone with whom you can work in a way that allows for enough, right? And maybe that's thinking like, okay, therapy, ideally you think probably at least 6 months, but maybe it's a year or maybe it's a few years, right? So really planning for like whatever choice you make, that it should be sustainable. It should fit your life. What to do if you feel that therapy is not working, right? It's quite possible that it's not working, right? That the specific therapist is not the right match for you, or the specific style of therapy is not the match for you, right? For some people, any talk therapy is like not the thing they want to do. And some people love talk therapy. You have so much to say and get so much out of talking, right? So that's like even like a beginning fundamental, right? Like if you have a sense like just talk therapy, I don't want to do it, it's not for me, it doesn't work, right? It's like I tried it, I don't want to do it again. Okay, there are other ways to do therapy, right? That are not first of all dependent on talking, right? There's somatic experiencing, right? There are all kinds of creative arts therapies using any of the expressive arts. You could do dance therapy, right? If that works for you. Music therapy, drum it out, right? Sing it, right? There's equine therapy, working with horses, which is amazing, right? There's something about human nervous system and the horse nervous system. Maybe that's your way, right? There are various or like unusual, there's hypnosis, right? Maybe that works for you. So there's so many different options. If like the conventional just sitting there and talking thing is not for you, okay, find something else, try something else, right? Also, you may not be well matched with your therapist, right? So if therapy is not working, first of all, see if you can make it better by talking to your therapist. Say like, be an adult in the therapy room. And that means like share your thoughts, express yourself and say like, I don't feel this is working for me. Help me. Like, let's figure this out. Like, is it working? How would I know if it's working, right? It's okay to bring that to your therapist, right? So try to be like really honest and open and assertive in the therapy room, like how to be not a child, right? With like a parent figure, but an adult, right? And if you don't like something or you don't agree with something, say it, right? Just say like, well, I don't really agree with that, or that doesn't really land with me, right? And that gives you a chance to see if you and the therapist can course correct, right? And maybe change how you work, or, how you can empower yourself to be more active in shaping the therapy, right? You can say like, I want to work on skills more. Or actually, I don't want any worksheets. I just want to talk, right? That's really up to you, because you will feel and know yourself and try a few different things. Try something more structured, try something very unstructured. I've done so many different styles of therapy. And the first, 3 or 4 years of my experience with therapy was psychoanalysis, because I was training as a psychiatrist. That was at the time, the most popular kind of deep approach to psychotherapy. And I was on the couch 3 times a week, talking to the ceiling, while my analyst, psychiatrist sat behind me. That went on for 3 years. And I think I grew a lot, but then I was done. Right? I just don't have time to go 3 times a week. It doesn't fit my life anymore. I had to change. Right? So it's also different times of your life, different styles, different therapists may fit. It's okay to change. It's okay to have 2 very different styles of therapy. Maybe something verbal and something that's not so verbal. Right? And if it's not working, say something, right? Don't just keep going and being discontent and not talking about it, right? Maybe this is what you need to learn in therapy, is to talk about when things are not working, right? Maybe you're avoiding conflict, right? So the thing to do is to deal with that conflict in the therapy room, right? Maybe before you send an email, thank you so much, I'm going to take a break, right? The first thing is to actually see, oh, is this something that I actually need to learn how to deal with in the therapy room with the person I'm working with, right? Like if you've invested 6 months, this person already knows your whole life story, right? It might be worthwhile to give it some thought and have some conversations before switching therapists, right? Because the therapist said something you don't like. Well, just bring it to the room, right? The thing you said, in last session, I felt terrible. My need for being understood was not met. Okay, let's talk about it. This is what came up for me. I want to hear, where were you coming from? Why did you say that thing to me? I'm going to listen to you too, right? So you can have those conversations and they will be safe, right? Because when you try to do that, right, have a reasonable, conflict conversation outside of the therapy room with, your romantic partner or your mother, it may not go so well, right? Like you may trigger all kinds of things. It might be like, explosive in various ways. But in the therapy room, the goal is for that to be a safe laboratory of human relationships and human communication, right? So you can come in and practice having difficult conversations, practice expressing frustration, practice being honest about how something landed with you, practice, repair after rupture, practice saying like, there was a rupture, you didn't get me, the thing you said, right? Or I'm like, I feel lost, I'm just talking, you're not helping me, you're not saying anything, I want more structure, right? So that's the encouragement for you to really practice adulting, right, in the therapy room. Like try on clear, direct communication, honesty, integrity, conflict, rupture and repair. All these things are things to you can sharpen your skills in the therapy room, even if it's hard, right? It's the right place for getting better at these skills.